Mr. Speaker, I rise today in strong support of the bills in this rule. Mr. Speaker, only a few times in our history has Congress come together to pass legislation to dramatically improve the life of every American. Social Security, Medicare, Medicaid, the Children's Health Insurance Plan, the Americans with Disability Act, Medicare's drug benefit, and of course, the Affordable Care Act. We changed lives, we saved lives. And now we continue that work with H.R.3, the Elijah E. Cummings Lower Drug Costs Now Act. The passage of this bill will take this legislation forward to join those momentous commitments to the health and security of all Americans. Mr. Speaker, we pay more for our prescription drugs than any other country on earth. We have made incredible advances in medical science and developed cures not only for our own people, but also for the rest of the world. And yet, even when our own researchers and scientists have dedicated their lives to creating life-saving drugs, too many of our fellow Americans can't afford to benefit from their brilliance. In the United States today, a disease or a chronic condition can force you into bankruptcy or require you to choose between paying for medicine or paying for food or rent. Mr. Speaker, H.R.3 makes fundamental reforms to reduce drug prices, to keep the cost hikes to no more than inflation, and to limit out-of-pocket costs for those on Medicare, employer plans, and private health insurance. To help secure these patient protections, we will require our government to negotiate prices directly with drug companies. Mr. Speaker, I served as Secretary of Health and Human Services for 8 years in the Clinton administration. I repeatedly asked for the ability to negotiate with drug companies. Only drug companies get to come to Medicare and set their own prices. Hospitals don't get to do that. Doctors don't get to do that. Home health care agencies don't get to do that. Medical equipment providers don't get to do that. Negotiation is the hallmark of good governance and a standard feature of government policy. Mr. Speaker, we negotiate for everything, including military equipment and work with contractors. If we can negotiate for big ships, we can negotiate for little pills. It is only drug companies that are able to write themselves a blank check from our taxpayers. Our legislation ends that practice. Now it is the time to join every other country on earth in allowing our government to bargain for better prices and to put a cap on our out-of-pocket costs. As citizens, we've always been willing to subsidize poorer countries. But subsidizing England and France and Canada and Germany, Australia and Japan, Sweden and Norway and Denmark is not our responsibility. We are not their deep pockets. Mr. Speaker, we should not pay substantially more for the same medicines than people in those countries. The current broken system is costing our families and businesses hundreds of billions of dollars. We must not accept this waste or this unfairness any longer. Our bill is a solid plan to reduce out-of-pocket health care costs for every American, and it will create a huge savings for taxpayers. These savings will allow us to make significant investments in the extraordinary biomedical science institutions that foster innovation, such as the National Institutes of Health and our great research universities. These savings will allow us to modernize Medicare hearing and vision benefits and dental coverage. This bill will expand our capacity for innovation and make drug companies more efficient. H.R.3 is a historic step forward, and it will make all of our lives better. Mr. Speaker, this rule also contains the Bipartisan Farm Workforce Modernization Act of 2019. This bill empowers families to build lives in the United States without the constant fear of being uprooted. It prioritizes the well-being of immigrant families, many of whom provide essential support for our nation's agricultural sector. This bill is an important step forward in improving our immigration system, in helping to make sure that we treat everyone with compassion and dignity. Finally, this rule also allows for consideration of the National Defense Authorization Act conference report. The first NDAA under our new Democratic majority fulfills one of Congress's crucial constitutional duties, providing for the common defense of our nation. The final conference report delivers a wide-ranging list of priorities the American people strongly support, such as paid parental leave, the end of the widow's tax, better services to our men and women in uniform, and protections for dreamers. This report is a product of months of hard work by Chairman Smith and members of the committee, and will undoubtedly keep our country safe. Mr. Speaker, I proudly support these historic steps forward. Let's pass this rule and these bills. Mr. Speaker, I reserve the balance of my time.